Hi, my name is Gail Hausman. I'm a nurse with ALS United Mid-Atlantic.
Hi, I'm Jessie Meyer. I'm a social worker with ALS United Mid-Atlantic, and we're going to be talking about hospice and hospice care for the patient and family living with ALS.
So what is hospice care? Hospice care is care that's provided to the person who is at the later end of their life. When a physician prescribes hospice care or they order it, it's a rough guesstimate of a person who has 6 months or less to live, but that is a subjective number. The primary goal of hospice care is to provide comfort and support for the person who has ALS and their loved ones. But comfort is the key word. The care that's involved is similar to the care that they get at the ALS clinic, in that there's usually a team of folks who work for hospice who will come out to the house or wherever the person is living to provide care. And that's always a nurse. So there's a nurse that you'll get to know, a home health aide to help with your physical care. There's also social workers, chaplains who are non-denominational, and then occasionally there's some other folks on their team. And the goal is, again, to provide care and support. Care can be provided anywhere. It's usually provided in the home, but if you're in a nursing facility, you can still have hospice care. So hospice is just about always covered by health insurance, including Medicare. It typically involves a nurse that will come out at least weekly, and that person should get to know you, should get to know, what's going on with you and try to deal with symptoms as they come along or prior to, before the symptoms get bad. So the other folks involved would be a home health aide, usually at least several times a week, a social worker, and a chaplain. The chaplain's there to help you deal with some of the, issues related to what you're going through, as far as the existential concerns about being where you're at that point. One of the really nice things about hospice is that there's a 24-hour, 7-day-a-week on-call nurse available. So if you get into trouble at 3 a.m. on a Saturday, there's somebody to call, and that nurse will help by usually initially walking the caregiver through what needs to be done, and if that doesn't work, the nurse will come out and make a home visit, no matter what time. There's medication that they will send you that they'll ask you to put in your refrigerator, and that medication is to be used for emergencies, and that's, then you would call the nurse, and the nurse would say, okay, take out the medicine and give about half a teaspoon of whatever it is that they're treating you for. Hospice is supposed to provide the necessary equipment needed for your comfort. Comfort is always the key word.
So some things to think about when you are transitioning into hospice care are some of the things that are not usually covered by hospice. So this is important to think about as you transition your care, because there are some things that some folks feel inclined to continue on, and it's just important to kind of think through what are your options as you're moving forward with something like hospice care. So medications that are not related to providing comfort care usually are not covered by a hospice team, and these would be medications that we refer to as the 3 R's: riluzole, Radicava, which is also known as edaravone, and the medication Relyvrio that was pulled off the market because it was shown to not be helpful to folks living with ALS medication. So if you are somebody who is taking one of these medications, it's important to talk to your doctor and your care team and the hospice team about sort of your goals of care with those medications because they're typically not covered by hospice. Some medical equipment that's not related to providing comfort care won't always be covered by a hospice provider. Some expensive pieces of medical equipment, such as a power chair, some communication devices, such as like a Tobii Dynavox. These are things that usually the clinic team tries to work with the family and getting all those things early enough that you will have them before you transition into hospice care. That's not always possible, so that's when you really want to kind of lean on your clinic team and your hospice team to find a way to sort of navigate those issues. One other thing that is not always covered by hospice that is important to think about is there's certain doctor's visits that are not going to be covered. So hospice is considered palliative care, so it's nothing that is focused on curative in nature. So certain doctor's visits, for example, maybe like the dermatologist, the eye doctor, those things might not always be covered by your hospice team. So it's just important to talk through those things prior to signing on so that you have a really clear understanding of who your main go-to medical providers are going to be throughout the duration of your care. There are two things to think about when you are exploring the possibility of hospice care. So hospice is a very specific term that, as we mentioned before, is used to classify somebody who's sort of in that last sort of 6 months or less. Again, that's a general term, but in that sort of phase. But there is also another option to think about that is called, it's a wider umbrella called palliative care. And palliative care is something that's underutilized, we think, in our community, that a lot of people could really tap into, and you don't have to necessarily be within that 6 month or less Medicare guideline window to really benefit from. So the difference between the two of them is that, where hospice tends to focus more specifically on end-of-life care and comfort throughout that whole period, however long that may be, palliative care tends to focus on problematic symptoms. So, they're looking at somebody who has a diagnosis that isn't necessarily curable, but they're not at a phase right now where they're really showing rapid decline. Where hospice tends to have like a very specific care team and a total care approach. A palliative care team can be in addition to all the current care teams that you have. So it can be utilized for anybody with a chronic illness. You don't have to be in that 6 month window. Hospice does tend to provide 24-hour support. Like we mentioned before, there is that 24/7 nurse call line that you could always reach out to. Palliative care isn't going to have that option. They usually involve maybe a nurse practitioner visit about once a month, but usually that can happen in the home, which is a huge benefit as well. So one of the biggest differences between the two, where hospice's goal is really going to look and focus on maintaining patient comfort and support for the patient's loved ones, versus palliative care, who really their focus is mainly symptom management, and those two tend to be both really good options for anybody living with ALS.
Thanks for attending our presentation. We hope you found this helpful.
If you have any questions or would like any further information, you can reach out to us. Our contact information is listed below.